Uh, Good day. Welcome to my session on potential efficacy of yoga in various diseases. My name is Dr. Manoj Sharma. I'm professor and chair of the Department of Social and Behavioral Health at the University of Nevada, Las Vegas. I'm also president of Health for All, and I'll be sharing my research in this area. So let us start by understanding what is yoga. There's a lot of confusion in the mind of people about what yoga is. So the origin of the word yoga is from yog in Sanskrit, which means union. So what is this union? If we look at yoga from a physiological paradigm, we see that it is the union of organ systems in the body, the various tissues and the cells, the homeostasis, what we call in physiology. So yoga helps us restore homeostasis. In the psychological paradigm, we have the various layers of consciousness, the subconscious, the unconscious, the conscious mind, and also superconscious mind. So it is a balance between these four layers of consciousness or the union. In the scientific paradigm, where we look at both body and mind, it becomes psychosomatic equilibrium or body mind equilibrium. In the philosophical paradigm, if we look at beyond just the body and mind, and we see that everything that we perform is because of internal energy, spiritual people like to call it soul or spirit. So it is the union of body, mind, and that in an internal energy, or what can lead to equanimity. If we go one step further, and we find that that internal energy is all pervading in all forms of creation, so it becomes in the universal paradigm where science and philosophy meet, it becomes the union of body, mind, internal energy with the universal energy or the oneness. So, yoga is an ancient practice originating in India over 4,000 years back. Yoga has been demonstrated to reduce stress and induce relaxation. There was a national health interview survey done in the United States, and it was found that it is gaining popularity in the US, where 12-month prevalence of yoga was 13.2% and 8.9% in the past year. So the same survey showed that about 31 million US adults have ever used yoga, and about 21 million practiced yoga in the past 12 months. And this is an old survey, but a recent survey has increased these number of users all over the world, not only in the United States. India, of course, has the largest number of users, but other parts of the world, I think yoga is being practiced all over the world. And all schools of yoga start with one or more of the stages of Ashtanga Yoga, or the eight-limb process that has been described by Patanjali 200 years before Christ. That is the first written record of yoga. So there are 5 yamas or moral techniques which consist of compassion, truthfulness, non-stealing, sense control, and avoidance of greed. So these have to be practiced by all devoted practitioners of yoga, which is sometimes neglected. And then there are 5 niyamas or personal observances, such as purity, both external and internal, contentment or santosh, discipline, self-study or swadhyaya, contemplation on Almighty or Ishwar Pranidhan. So those are the 5 yamas and 5 niyamas. Some schools of yoga believe that like, for example, Kundalini Yoga, which starts with meditation, they believe that as you progress in meditation, these yama and niyama automatically start surfacing in your lifestyle. The third step of yoga is the asanas, or the low physical impact postures. And this is popularly used by Hatha Yoga school of yoga, where asanas are the first starting step. The fourth step is pranayama, or breathing techniques, once again for homeostasis and mental balance. The first 4 steps are known as Bahirmukhi Yoga or outward yoga. And then the inner yoga or antarmukhi yoga are the next four steps, which are pratihar or developing dispassion towards senses for mental balance and equanimity, where we withdraw our mind from the sensory objects. And then dharan or concentration techniques for mental balance and equanimity. People in academia are already well versed in concentration, where they have to do research and they focus on various topics so that concentration can be developed through a variety of techniques. And then the seventh step is that of meditation or dhyan. And finally is the samadhi or universal consciousness, in which the meditator, the meditated, and the point of meditation all become one and the same. So the purpose of my presentation is that I will be discussing the efficacy of interventions using yoga as an integrative therapy for a variety of diseases based on the evidence that I have published in the form of systematic reviews over the years. And the specific diseases that I have examined are hypertension, diabetes mellitus type 2, arthritis, depression, anxiety, low back pain, bronchial asthma, cancer, and particularly breast cancer. So the method that I did in this review is I located all the systematic reviews pertaining to yoga and selected diseases published by me, and they have been included in three databases: Alt Health Watch, Cinehel, which is the cumulative index for nursing and allied health, and Medline, which is the medical literature analysis and retrieval system online, which can be accessed through the common platform called PubMed. So these are the my methodology. So let us look at the first application that I studied, which was yoga and hypertension. So I examined studies between 1972 to 2012 and located 19 such studies. Out of these 19 studies, 12 of them demonstrated a significant reduction. By significant, I mean a statistically significant reduction in blood pressure, high blood pressure, as a result of the yoga intervention. The remaining 7 studies also showed a reduction, but it was not statistically significant. By statistical significance, we mean p-value less than 0.05. And but only 6 studies utilize the randomized control design, which is considered to be the gold standard in medical science. So only 32% use the RCT. And the schools of yoga used were 5 yoga interventions utilized pranayama, 4 used asanas or low physical impact exercises or hatha yoga. One used transcendental meditation, which is a form of meditation or dhyana. One combined yoga with naturopathy. One intervention was based on Iyengar yoga, which uses asanas. One intervention was based on Sudarshan Kriya yoga that uses rhythmic breathing exercises. 3 interventions used Shavasana or corpse pose. One used Ashtang Vinyas or coordination of breath with movement, and 3 used unspecified yoga techniques. So these were the various schools of yoga that studied yoga and hypertension. The duration was also not standardized. It ranged from 6 months to some intervention which only used one-time practice. And the review recommended that the intervention must be at least 2 to 3 months long with regular and sustained practice of yoga, which was the duration in many of the or majority of the studies. So based on this review, I could not conclude definitively that yoga is efficacious in reducing blood pressure because of the small sample size and paucity of studies and few studies using RCTs. But it appeared to be a promising approach because many of the interventions showed a statistical significance and almost all of the interventions showed a reduction, even though it was not statistically significant. So it is a promising approach for yoga and hypertension. The other condition that I studied was type 2 diabetes mellitus and located 17 studies. Of the 17 interventions, 11 interventions measured fasting blood glucose, and of these 9 interventions, or 53%, were able to show a significant decrease in fasting blood glucose. Only 5 studies, 29% utilized the RCT. So once again, very few studies used the RCT. The schools of yoga, 15 of them used yogic asanas, 12 used pranayama, one each used shatkriyas or cleansing exercises, yog nidra or shavasana, which is the corpse pose. And the duration of intervention ranged from 8 days to 24 weeks, with the majority of interventions, outcome evaluation occurred between 30, 40, and 45 days. So about 1 to 1.5 months. And once again, the conclusion was that there is paucity of studies and few RCTs, small sample sizes. So the yoga appears to be a promising approach. The third condition that I studied was yoga and arthritis, and I examined I published a systematic review in 2014, and the review found that 6 studies or 72% demonstrated positive changes in psychological or physiological outcome measures related to arthritis, but only 2 or 22% used the RCT, and sample sizes were very small, with only one study having a sample size over 100. So the duration ranged from 6 hours to 46 hours. The mode was 12 hours with a mean of 18.6 hours. The short interventions were able to make changes only in the short term. Long-term sustenance of effect was found to be questionable. So once again, efficacy could not be definitively concluded. There's a paucity of studies that have examined yoga with arthritis. However, it appears to be a promising approach, just like hypertension and diabetes. Then the fourth condition that I studied was yoga and hypertension. And I looked at 23 interventions. The study designs were randomized controlled trials, quasi-experimental, pre-test, post-test, with majority being RCTs. And that was the nice thing with this condition, that majority of the interventions were randomized controlled trials. 20 interventions found yoga to be effective in treating depressive symptoms. 3 studies in stroke patients, pregnant patients, and breast cancer patients did not find significant impact. So for special conditions, it was not found to be effective, but in normal depression, it was found to be effective. And the most common school of yoga was Hatha Yoga, or the asanas. And there was a small sample size ranging from 14 to 136. So not large sample sizes in these studies. And the range of duration was from 1 week to 24 weeks, majority being 6 weeks or longer. So we can conclude that there is limited evidence that yoga may influence depression outcomes in several populations. Why we say limited evidence and not promising approach is because consistency of evidence. There were 20 interventions, biological plausibility, because yoga can work on the neurotransmitters, strength of association, which was found by effect sizes in the interventions, temporal association because of the randomized controlled trial and longitudinal nature of the intervention, and coherence because of the consistency and coherence, meaning that the specificity of the association was found. So yoga can be used in conjunction with pharmacotherapy. Then we looked at yoga and anxiety, and this is also a well-researched area with 27 interventions, and 70% showed a significant decrease in state or trait anxiety through the use of yoga, and 18 or 67% used randomized controlled trial. So that was really a sizable number of RCTs. And duration ranged from 1 time all the way to 7 months, 3 months and 6 months being common. 2 months and 3 months being common. So once again, we can say that there is limited evidence that yoga is efficacious in lowering anxiety. Once again, consistency, biological plausibility, strength of association, temporal association, and coherence are in favor of efficacy of yoga for treatment of anxiety. Another condition that we studied was low back pain. As you all know, that low back pain is a difficult condition to treat, but there were 13 interventions, and of 13 interventions, 8 were performed in the United States, 3 in India, and 2 in the UK. And 13 studies utilizing yoga as the intervention, 9 or 69% showed increased flexibility, decreased pain, and decreased disability scores. 9 studies or 69% utilized the randomized control design. So the duration ranged from 1 week to 6 months twice weekly. And once again, in this area, we can say that there is limited evidence. Low back pain is a difficult disease to treat and requires long-term physiotherapy. And yoga can be one form of physiotherapy for such patients. Once again, the causality criteria of consistency, biological plausibility, strength of association, temporal association, and coherence were uh, met to a large extent. The other condition that we studied was yoga and asthma. And we had 15 interventions here, and they were done all over the world. 7 were in India, 4 in UK, United States, 2 in UK, 1 each in Australia and Ethiopia. And 10 or 67% documented a significant change in one or more of the objective or subjective outcomes, such as FEV, forced expiratory volume in 1 second, peak expiratory flow rate, PEFR, airway resistance, RAW, or asthma quality of life questionnaire, which is a self-reported AQ-LQ score. So 11 used randomized controlled design. And the intervention ranged from 6 months, 4 months, 3 months, 2 months, 40 days, 1 month, 21 days, and 2 weeks. Limited evidence, once again, slightly better evidence in this case compared to some conditions, but there is a paucity of studies, and the criteria of causality were met to some extent. Then yoga and cancer. In cancer, of course, it is not for treating cancer, but for allaying the side effects of stress and anxiety, chemotherapy side effects and things like that. So we found 13 interventions. 8 were implemented in the United States, 1 in Canada, 1 in Italy, 1 in Slovenia, 1 in Turkey, 1 in United Kingdom. So 11 reported statistically significant changes in mental or physical functioning of their participants. There were 46% or 6 interventions, which were RCTs. And duration ranged from one-time inpatient 45-minute yoga session, 1 week, 3 weeks, 4 weeks, 6 weeks, 8 weeks, 12 weeks, 3 months to 2 years. So it once again appears to be a promising approach for reducing stress associated with cancer and chemotherapy. And on other modalities pertaining to cancer, the evidence is in its preliminary stage, and more randomized controlled trials are needed. And then specifically, we looked at breast cancer survivors and found 23 interventions, 9 in US, 3 in Germany, 3 in India, 2 in Turkey, 1 each from Australia, Canada, Iran, Taiwan, Poland, and UK. So 22 of the 23 interventions had statistically significant changes in studied outcome measures, and 21 were RCTs. So this is a well-studied area. But the intervention ranged from 4 to 24 weeks, and the average duration was 30 hours. The mean and median were 18 hours. Is an integrative, is a promising approach. So this is the summary of evidence of yoga on various diseases. So hypertension, we had 19 studies, 12 were successful, promising approach. Type 2 diabetes mellitus, 17 interventions, 9 were successful, promising approach. Arthritis, 9 out of 6, promising approach. Depression, 20 out of 23, limited evidence. Anxiety, 19 out of 27, limited evidence. Low back pain, 9 out of 13, limited evidence. Asthma, 10 out of 15, limited evidence. Cancer, 11 out of 13, promising approach for stress reduction. Breast cancer, 22 out of 23, promising approach, once again, for stress reduction. So overall conclusion, ultimate purpose of yoga is not disease prevention or treatment. It is a promising, efficacious adjuvant to management of hypertension, diabetes, arthritis, depression, anxiety, low back pain, asthma, cancer, and breast cancer. More RCTs with larger sample sizes for both efficacy at the small scale and effectiveness at the larger scale need to be conducted. And none of the interventions utilized any behavioral theory to operationalize, to maintain sustenance of yoga practice. So that sustenance of yoga practice is very important, and newer theories like multi-theory model of health behavior change can be utilized for ensuring sustenance of yoga practice. And these are the references. Thank you very much and have a nice day.